Hello, and happy to be presenting to all of you at MED INVADE this year. I'm here to introduce the 51st World Conference or Union World Conference on Lung Health to you today and give you a little bit of background on the Union. My name is Dr. Carrie Tudor, and I am the chair-elect of the Coordinating Committee of Scientific Activities for the Union World Conference on Lung Health. So let me first start by giving you a little bit of history about the Union. The first international conference on tuberculosis was held in 1867, about 15 years before Dr. Koch actually was able to identify the germ that caused TB. The Union traces its origins to these gatherings of experts from around the world who were determined to collaborate and find a common solution to the White Plague, or tuberculosis. The International Union Against Tuberculosis was formed by 31 national lung associations at the first meeting in Paris in 1920. This was known as the Constitutional Conference. So a little bit more about the Union. The Union draws from the best scientific evidence and expertise to advance solutions to public health challenges affecting people living in poverty around the world. Since the Union's founding 100 years ago this year, we have been driven by the principles know, share, and act to find solutions to the biggest challenges to lung health. Our work spans TB, tobacco, HIV, and AIDS, lung disease, and non-communicable diseases across the lifespan. Our partners include government, international agencies, civil society, as well as the private sector. So now I'd like to give you a little bit of information about the Union Conference. And last year, this conference was held in Hyderabad, India, and I believe that many of you may have attended in person last year. Our executive director, Jose Luis Castro, has said that this year, or about the conference, that my hope is that this conference will galvanize our community in a new way to move from incremental steps to giant leaps towards the global goal to end the TB epidemic. So this year, the theme of the conference is advancing prevention. And this draws on the political declaration adopted at the United Nations high-level meeting on TB 2 years ago, which promised to prevent hundreds of thousands of TB infections and deaths every year. As we know, prevention is key to ending TB, reducing tobacco use, and improving lung health worldwide. Yet prevention has been neglected as a research and operational priority in this sector and has never really featured as a conference theme to date. With the threat of COVID-19, prevention is critical for limiting its repercussions on global public health. The 51st Union World Conference on Lung Health will put prevention at the center stage in this conversation. So why should you attend the Union Conference this year? This is a vital event for all those working on every aspect of lung health across the lifespan. The event uniquely focuses on the challenges faced by low and middle income countries. You will gain access to the world's largest gathering of clinicians and public health workers, health program managers, policymakers, researchers, and advocates working to end the suffering caused by lung disease. An excellent scientific program featuring over 300 sessions on TB, air pollution, and tobacco control, as well as this new pandemic threat that we're currently experiencing of COVID-19. So who attends the conference? As many of you may have been at the conference last year, it's a large conference and we have thousands of delegates every year from more than 130 countries. So it really is a global conference. Students, clinicians, doctors, nurses, public health workers, and other health program managers routinely attend. We also have an active civil society presence at these conferences with activists, advocates, and survivors of TB and lung disease. We have high-level speakers, global experts, and policymakers from across the globe, and influential opinion formers, VIPs, and high-profile media. This year, we're very excited that Dr. Anthony Fauci from the United States National Institutes of Health will be one of our high-level plenary speakers, our keynote speaker this year, and we're very excited that he has agreed to present. We can see here a variety of other high-level speakers, including Elizabeth Iro, the Chief Nursing Officer of WHO, and many others, as you can see here, and there's more information on each one of them on the union website. So the scientific program includes the plenary sessions, symposia, oral abstract sessions, meet the expert sessions, which this year we have a great selection of meet the experts. We have satellite sessions, special sessions, e-posters, regular poster discussion sessions, workshops, and we also have, we're excited to offer community connect sessions. And this is organized by our civil society team to make sure that the affected communities are included. And being on the committee that organizes this, I can tell you there are a lot of really wonderful things coming in the program this year. So we wanted to highlight, since most of you are medical students or students in other allied health professions, that we have a student registration discount of 49 euros, which is still expensive to many students I know, but it's a much reduced rate over the normal registration. So we really want to have the student voice included in our conference, and we hope that you will be able to attend this year and register. And there it is, the price there. And now we'll play a short video for you with some highlights from the conference from last year. And we really are looking forward to seeing you at the conference this year virtually. And thank you so much for the opportunity to present at the MED INVADE conference this year. I hope you have a good session, and we look forward to seeing you next month.
I'm here at the conference because I want to know best practices of the world.
To get informed about different problems in different parts of the world.
So I'm really excited to meet other TB researchers in other countries and other regions to see the advancements in TB treatment and notification.
Well, for me, the Union's World Conference is like a family reunion.
To gather knowledge from the international community, to learn more about the learning in the different parts of the world.